And while there are probably enough people walking in the halls of, the Capitol right now that are trying to let people know that, I know you don't think people are at the gates with pitchforks and, tiki torches, but they're coming. Like, this is going to have to change at some point. Like, somebody is going to have to recognize why this change is going to be necessary. People can't afford to live. And I would say of all the policies that would be considered left, even though it shouldn't be, to me, it's the most common sense social policy or economic policy that should benefit this whole country. And that, of course, is healthcare. And that would be single payer. There is no other solution that has worked in every other.
We disagree quite profoundly on that one.
Okay, so hit me with your excuse as to why single payer doesn't work or wouldn't work, even though it works in every other developed country on earth.
Well, okay. Let me take a step back, but I'll come to the healthcare by way of the bigger picture as I best understand it and what informs me. If I'm going to grant you something that I think is true, which is that we have oligarchic forces in our country, especially in healthcare. Healthcare is absolutely a cartelized mess in America. We do not have a free market. We have not had what I would consider to be a free enterprise system in a very long time. We have what the French would call a dirigisme, a mixed state-directed economy. That is what we have had certainly since FDR, but especially post the Great Society. The little nips around the edges of deregulation that happened with Carter and then Reagan and then to some extent Clinton don't change the fact that in like the 1950s, 95% of jobs did not require a government license, which erects barriers to competition. And today, like 50% of every occupation requires you to get permission from the government in the form of a license, including being a florist. You have to get a government permission slip in something like 30 states in this country to do interior decorating. And who issues that license? A commission of people who are the current local heads of current companies. And so I think what you have, and this is the I think the break point between an honest progressive who's not just sort of spouting slogans and an honest, like classical liberal, libertarian, whatever, free market type.
Sure.
That's not just spouting slogans. Government is a monopolizing force. It is a tool that gets exploited to create barriers to competition. It always has been. It is what it is. That is its nature. It is inescapable. And the problem, so that's a political problem, but then it creates an economic problem that is very profound, and most people don't really grapple with this. And that is that most things are far too complex for some central planner to decide. You know, when you think about healthcare is a perfect example of this. Healthcare is the delivery of services, right? It is not, that's what it is. I come from a family of doctors. My dad's an otolaryngologist, a surgeon. Both of his parents actually were doctors. In fact, my grandmother, Mary Longo, God rest her soul, delivered babies. She was a female doctor in Philadelphia when there were no female doctors around. And she was also the loudest critic of feminism you would ever meet. When you look at what ails us in this country when it comes to healthcare, the question is, what is it that we're talking about? We're talking about, can you afford to get the services you need for what is ailing you? And will they work or not? And how quickly can you get them? Can you get them quickly enough to actually deal with the problem? That is like that, you know, we talk about this stuff and it becomes like, oh, well, who's going to pay? Who's going to cover? Are you covered? Do you have insurance? All of that is like all these intermediary middlemen between like, I have a problem with my health and I need someone or some medicine or some treatment to help it, to mend it, to fix it, to ameliorate it, to keep it at bay, to keep it controlled. That's what we're talking about. And And that is
All
like
right,
this.
let's pause there for a second.
Yeah.
So we agree 100%. The whole purpose of why I am an advocate for single payer healthcare is because I want to remove the for-profit middlemen in between us and our doctors. I believe in the free market. I believe that if a doctor is good enough to make $1 million a year because he's the best one in the market for heart surgery, then he's entitled to make that. I think we need more nurses that are more well compensated. I do not understand how anyone thinks it's acceptable that we have for-profit hospitals. I don't know how anyone thinks it's acceptable that there is any reason to have Aetna, Cigna, Blue Cross, and yes, United. The whole concept behind the Luigi Mangione story is the fact that there were people that went up in arms about a healthcare, and again, it's not a healthcare, it's pro-health CEO or for-profit health CEO that bit the bullet, no pun intended, and yet that person is probably responsible for tens of thousands of deaths a year because of the for-profit nature of the health system. And so it depends on how you kill someone. If you kill someone with a gun, it's a problem. You kill them with a fountain pen, it's acceptable. And that in itself is where I think things have to change significantly. Now, we know that any other country that you want to measure it to, and there are ones that are clearly better than others. If you are as successful as I believe you are, and you probably are a world traveler, you've been to other parts of the world, whether it's France, whether it's Germany, whether it's Japan, whether it's Australia, 4 of the countries, all of the Scandinavian countries, they all have superior healthcare available compared to what we have here. And obviously at a fraction of the cost. So what my proposal is.
No, I don't agree with a lot of that. As a matter of fact.
Okay.
So I like we can like let me make the case for, because I'm not making the case for the status quo. Let me just say this: if you made me king for a day today, what I would do is, I mean, if you said implement your perfect system, well, I'm kind of a libertarian utopian if you really push me to the ethical limits, and I would say, well, get the government out of all of it. But if I was going to be incrementalist and create something better, I would create something like a universal, high deductible, catastrophic plan where you come out of pocket right up until the point where you really, really are in a big situation. So I don't know how you'd probably have to adjust it for cost of living in different areas. But the problem with American healthcare is not the profit motive. I think that is very fundamentally untrue.
Okay, so then let me push back on you.
But let me just make a couple points real quick to that. 80% of the hospitals in this country are not for profit.
Sure.
Many of them Catholic. Now, the for-profit, not-for-profit is also kind of a canard because many of these non-profit hospitals, we have one here, Ascension Health here in Austin, and their CEO makes $3 million a year. Now, you can say like, well, isn't that profit? And the answer is, well, kind of, yes, it is, right? They don't technically issue dividends. They don't have stockholders that benefit from the rising value of the company. So in that sense, it's not a for-profit. But I think the problem is that this notion that pursuing retained earnings at the end of the year is the root of the problem in healthcare, I think is more ideological than factual. And there's several examples of why that's why. One of which is it in most states in this country, if you want to open a hospital, or even if you want to in your clinic add an MRI machine, you have to get approval in what's called a certificate of need, as if there should be need to be an explanation of why we need more supply of healthcare services. But that is a fact. That is a legal structure in place in this country, in a country whose most of their hospitals are not-for-profit charitable entities, technically. Why? Because that's the government monopoly power. So when you have this ability of the government to regulate the supply of healthcare services, it turns out the local hospitals, which are big political players, for profit or not, like these rules that make it so that they don't get competed with. And that just is shot through the entire system. It's completely crazy. So and I think on the European front, the fact is that they all ration care in one form or another. We do spend a lot more as a total share of GDP than European countries on average by quite a bit. We have better health outcomes on a whole range of measures. And we also have worse in many instances. However, one of the things you have to do when you look at the stats on the outcomes, like American health, American interaction with the healthcare system, is you have to strip out the stuff that's got nothing to do with healthcare. For example, if we have a lot more gang violence involving guns, that's got nothing to do with healthcare. Like the fact that more people die in the ER of gunshot wounds in the United States than in Sweden is not an indictment of the US healthcare system. And that kind of stuff, the extent to which we have greater levels of fatalities, the extent to which our population is fatter and sicker because of lifestyle diseases, like basically being overweight, our food system is a catastrophe. But those are also personal choices people make. I'm just saying, like, it's very easy to say it's all about we just need to have the government, who's been a bad actor in the States pretty much throughout, up and down the entire system, if they just take over the whole thing. And I think the argument for this is really weak. It's basically slogans. And the last thing I'll say, and I'm happy to just have as much back and forth on this as you want. I don't know how anybody can look at the way the government and the leading institutions of healthcare in this country and around the world handled COVID and come out of that saying, yeah, I want those people to be the only ones that decide whether my healthcare services will be paid for or not. Like, I don't get it. I don't get how single payer. I'd be curious, like, how did COVID not kill your desire to have the government that locked us down, lied to us at every turn?
Well, I'm gonna interject there because here's the thing: there is a difference between government funded versus government run. I think that people have a really hard time understanding that there is a distinction between whether or not you have a single payer system that still supports a free market economy. If a doctor is capable of doing the job better than the next doctor, he's capable of making what he's capable of making. I don't have any issue with that. But what I do have a problem with is that there is no point in having for-profit middlemen in between us and our doctors. We are the only developed country on earth that has medical debt. We're the only country on earth that has a healthcare system in which over 70,000 people that we're aware of die every year as a result of lack of care or undercare. Then you also take into account that we have a free market economy based on whether or not people will live or die. So the idea that you can trade—
but that's not really, again, with all due respect, in every single country on this planet, there are people who don't get the healthcare services they need to keep them alive. Sure. And they die as a result.
Sure.
So like, it's not the case that I would say, look, there's big differences across the spectrum. Switzerland has a system that technically is more for-profit oriented than America, in which more of it is managed by a more truly competitive market and private insurance companies. France has single payer, but doesn't own and operate the hospitals. Canada and the UK, both of whom suck. And the NHS in the UK is a constant political problem, and it's getting worse by the year.
Yes,
that's a wholly owned government-run job.
I definitely listen. I've heard enough stories about what's going on in Canada. I know that there is rationing of care. It also depends on what city you're in and what province you're in. Anyone that I've ever spoken to that's from Calgary will tell me that it's the worst system ever. And then I'll talk to people who are in Vancouver and they'll say it's the best system ever. So it really just depends.
And the same thing goes for Sweden. Sweden has a very decentralized system where the funding is decentralized. So I think you're right about this. And I'm not one of those people that just clumps all these things together as some monolith of socialism. There's a bunch of different systems, and some of them get closer to a free market, profit-oriented system than ours. I just think that it's very easy with something this complex
All right, so let me put a suggestion to you, because I think
Sure.
that what puts a button on this topic, because you obviously stand where you stand. I do not. Like I said, I have. There are people who simply think that there should be no there should be no profit motive whatsoever in healthcare. Okay, I understand that, but you know what? As we said when we briefly spoke on the phone, the problem with people on the left is they do not take human spirit into account. The people on the right do not take human greed into account. So trying to find that medium where we can come together and recognize that this is what is absolutely necessary in order to survive and thrive. I think whatever it's going to take to eliminate that for-profit middleman who does not need to exist, I think is the first step. Now, you may not agree with single payer, but what I've often suggested, as I do with my libertarian friends, I'll give you one, you give me one. I support ending the Fed. If I give you supporting ending the Fed, I want you to give me supporting single payer. And we'll figure out how to make it, and we'll figure out how to make it work in a system that does not require people to go bankrupt in order to stay alive, because we're the only country that has it that's developed. Yes, there's problems all over the world. We all know it. However, it is painfully clear that the system we have is the only one that is based on profit at this level in terms of development. Yes, these other countries have problems. No one is going to say that they're perfect. And yes, money talks and justice walks. If you have money, that's a huge advantage over those that don't. But that's not an excuse. People need to have health in order to live. And it also is of tantamount importance to have some type of a meeting of the minds in terms of, this is where things are going. This is where they need to go. But also, there are people who, I agree with you, John, rely way too heavily on whether or not the government can save them. It doesn't work. That's why I'm very libertarian in a lot of ways as well. The government can't save you. The government should exist, but the way it exists today is to basically trap you. And that is where things, I believe, go off the rails. And just taxing people more, that's not the solution. That's not how you're going to do it. There are ways to do it. But from where I stand, healthcare, that is without question the number one issue that I believe the left has correct in terms of the baseline. Now, how we get there, that's going to be the bigger trick. And that is, to me, something that someone who has experienced different health systems, and I can assure you, the model that we have, maybe not the care, because that's a point you bring up, which is fair. I can understand that. But in terms of the model, we have the worst model in the world as a developed country, period. I would never give an inch on that, because I think anyone who has seen what this health system has done to people that I know, and this health system has killed people I know that I cared about.
I mean, look, let me grant you something fundamentally.
Sure.
Like, I am not a defender of this system. I mean, let me just tell a very quick story, because I know we want to talk about some other stuff.
Sure.
I got COVID. I think this was 2023, summer 2023. I was struggling to swallow. I go to the doc, ear, nose, and throat doctor here in town. Looks down the throat, says it's covered in sores. She's like, there's nothing really that can be done about this. You're okay. You just need to like basically gargle some painkiller and wait it out.
Yeah.
She writes me a script to walk across the street to the hospital to just get an IV to replenish, because I haven't been able to drink any water, and she doesn't want me to get dehydrated. And I ask her, I say, Doc, I don't want to go to the ER and get some $5,000 frigging bill to get IV saline and a gargle of some Novocaine, because I'll just go home. Can you promise me that that's not what's going to happen? And she, oh no, for sure not. It's a script. I go in, I walk in. It's like, okay, I'm in front of the lady in front, checks me in. I ask her, what's the deal here? What's this going to cost? Nobody knows what anything's going to cost. I go in. There's nobody there. I go into a room that feels like it's 1989 Ukraine, because that's what hospitals feel like. I get a gargle and an IV, and I get a $5,000 fucking bill. which I don't pay for a year. I just don't pay it. I'm like, I'm not paying this. What is this? This is a nonprofit Catholic hospital system. And it's because it was the ER, even though I literally, like, I know what it's like. I should have known, like, I shouldn't have even walked in. And like, so I know, I know what it feels like. I know what it is. I'm not like disembodied from the absolute bitter rage we all experience when you go and deal with this effing system. I'm just saying, people that fix things, the precursor to fixing things is properly diagnosing what's broken. And I think we disagree on what's broken here by focusing on profit instead of the massive regulatory catastrophe that is below the surface. And it just is. I can geek out on this stuff, and it flies over, and people are like, yeah, what are you talking about? You're carrying water for the insurance companies or something. It's like, no, it's not.
But here's the bottom line. If there is a profit motive, then the goal is always to extract as much profit from it as possible. Because in the end, if you are
yes, that's true at the individual level. But even Karl Marx understood that one of the things about the reason why Marx believed that capitalism would kind of deliver a suicidal post-scarcity world is because he recognized that competition is what squeezes the profit out of the system. So we have an insufficiently competitive system. That's I am with you. I don't want excess profits. I just believe that competition, I'm kind of with Karl Marx on this. Competition will wring the profit out and keep it under control. And a monopoly just creates bureaucracy and creates administrators. And those are all people who are profiting on the system.
But who wants that? But who wants that? The people who want that.
You don't.
Neither do I. Neither does anybody else. But the only people who want it are the people that are financially benefiting from the system. That's why there's so much government regulation. This is why I keep saying it until I'm blue in the face. There is so much more crossover between progressives and libertarians than they are generally willing to admit. That's why I listen. First of all, James Lindsay's got to learn to get that smug look off his face every time he's in front of a camera. Because he's got so much rage at the world. And I keep thinking, like, yeah, and it's like the chat is saying, on the one hand, they hate you. And then the next minute, they're like, oh, John's so close to understanding what this is. I know you understand what this is. I also understand where your philosophy comes into play. I agree with you. I don't want the government running it. But that's not what single payer is. There is this idea that everyone wants to turn this into the VA. That's not what we want.
I'll tell you what, my middle ground is we can lock arms on a single, very high deductible insurance plan that makes sure nobody goes bankrupt, but otherwise helps you pay cash, let you pay cash. If you had to pay cash, if the doctor's office didn't have 5 people in accounting, but it was mostly doctors, not administrators, and you paid cash, they'd tell you what the price is. You decide, like every other service in our whole friggin' society, including food, which is more important than healthcare. You go to the grocery store, you're like, you know what? This is too expensive. I'm going to get the cheap one. And then that would take care of a huge amount of the problem. You'd be left with stuff like my kid's born with leukemia, or I have a chronic rare disease. That's all real. That's why I'm saying, look, I've got a middle ground for you, but that's as far. We need price signals. We need competition. We need choice. We need people being able to walk, vote with their feet. That's the part of it that keeps it honest to me.